Ever wondered about the unseen threats that could be buzzing around your barn? One such invader is the West Nile virus, a mosquito-borne disease that can have serious implications for our equine friends. The West Nile virus, often abbreviated as WNV, is a member of a family of viruses known as flaviviruses. While it can affect various species, including humans and birds, today we'll focus on its impact on horses. You see, birds play a unique role in this disease cycle. They serve as the primary reservoir for the virus, essentially acting as a host where the virus can multiply. Now, when a mosquito bites an infected bird and then bites a horse, it can transmit the virus, causing the horse to become infected. The result? Potentially severe neurological symptoms. With the bite of a tiny mosquito, the life of a sturdy horse can take a precarious turn. So how does this invisible enemy find its way to our hoofed companions, you might ask? Well, West Nile virus, a mosquito-borne flavivirus, is primarily transmitted to horses through the bite of infected mosquitoes, particularly those of the Culex species. This happens when mosquitoes feed on birds carrying the virus and then during subsequent feedings pass it on to horses. Once the virus has taken root, symptoms begin to manifest. Initially, a horse may develop a fever or show signs of weakness and lethargy. As the virus progresses, more alarming symptoms can appear. The horse might experience muscle tremors or twitching and a loss of coordination known as ataxia. In some cases, the horse may stumble or even be unable to stand, a state known as recumbency. The effects of this virus are subtle at first but can quickly escalate, wreaking havoc on a horse's neurological system. The impact of West Nile virus on a horse can be profound, but there are ways to fight back. West Nile virus doesn't discriminate. It can affect all horses, regardless of age or breed. However, it's important to note that older horses or those with compromised immune systems may be more susceptible to developing clinical symptoms. Once a horse is infected, the virus can cause severe neurological disease, often leading to symptoms such as muscle tremors, loss of coordination, and even the inability to stand. In the most severe cases, the outcome can be fatal. This is why understanding the impact of the virus is so crucial. But it's not all doom and gloom. There are effective strategies to prevent the onslaught of this disease. One of the most critical steps in preventing West Nile virus in horses is vaccination. Regular vaccinations are essential in building a horse's immunity against the virus. Vaccinations are typically administered annually, but in areas where the virus is prevalent, more frequent vaccination may be recommended. Next, we turn our attention to mosquito control. Since mosquitoes are the primary carriers of the virus, reducing their population and limiting their access to horses is a key preventive measure. This can be achieved by eliminating standing water where mosquitoes breed and applying insect repellents designed for use on horses. Finally, let's talk about surveillance. Keeping a close eye on local bird and mosquito populations can provide early warning signs of West Nile virus activity. Birds serve as the primary hosts for the virus, and mosquitoes become carriers after feeding on infected birds. By staying vigilant and monitoring these populations, horse owners and veterinarians can act swiftly to protect horses from potential outbreaks. With knowledge and vigilance, we can shield our equine friends from the silent, buzzing threat of the West Nile virus. Remember, prevention is always better than cure. If you found this video helpful or interesting, show some appreciation by hitting the like button and subscribing for more. This helps us a lot so we can make more informative videos about horses.